All right, time to get our bi-weekly check-in with Dr. Ernst von Schwartz, getting the very latest on the coronavirus pandemic. Dr. von Schwartz, good morning. Thanks for joining us once again. We see improvements every time that we talk. Kind of give us where things stand right now. You know, you're in a hospital on a daily basis. What's it like?
Much better, Joe. Much better, no doubt. If you look at the numbers as of yesterday, in California, there were 4,100 new cases of COVID diagnosed. Compare that to 2 months ago with 53,000 cases per day.
Yeah.
It was at the highest. So we see that we still have patients in the hospital with COVID, but no comparison. I think the worst is over.
That's great. And I know you had said that last time too, so it's good to see that those numbers are still holding and even improving. When it comes to these new CDC guidelines, people that are vaccinated being allowed to get together, you can drop the masks, you can hug your grandparents if both of you have been vaccinated. It's usually a huge game changer, right?
Absolutely, and I'm glad about that. I mean, if you're vaccinated, within 2 weeks after the second shot, you should be fully immune. So that's what the CDC says. At that point, you can gather with family members, even if those are not vaccinated, but you are, in smaller groups without distancing and without masks. I think that's a positive sign.
Where do we stand with vaccines? I know more and more people are able to get them. It seems like the process of getting a vaccine has improved over the last few weeks as we've had now 3 of them that are approved. Are we seeing more of that rollout coming?
Yeah, and especially with the third one, the J&J vaccine, which doesn't require a deep freezer but can be kept in a refrigerator. We want to use that in our offices, actually, because it's a single shot, and more and more people call us every single day and ask for that particular vaccine. When can I come in? When can I get it? So we expect 20 million doses before the end of this month. And we in the office, we want to get them.
All right, now you are a cardiologist. You work with the heart, obviously. During lockdown, has there been a little lack of libido? Lockdown libido has kind of been an issue for some people, right?
There's a couple of things to consider. One is, of course, COVID itself, as per some studies, has shown to reduce testosterone levels in men. So if you had COVID, your testosterone more likely is significantly reduced, which reduces your sexual desire. But independent on that, the lockdown psychosis, the economic hardship, the depression, the anxiety caused by loss of jobs and financial hardships, all this, of course, affects the mental state, and the mental state affects sexual desires. And there's a big difference in the early phase of the pandemic compared to now. In the early phase, there was actually more family getting together. People stayed in their homes with their spouses. There was less infidelity because there was no options actually to go out, and less divorces. But now, over time, that has changed completely. And a recent study from Turkey showed that even the frequency of sexual intercourse during the pandemic went significantly down for mainly mental reasons and depression and anxiety. And now we see even more separations and divorce filings in the courts.
Interesting stuff. Dr. Ernst von Schwartz, always good to talk to you, and we will check back in with you in about 2 weeks, find out how things are going now in this pandemic. Thank you.